Hello, and welcome to our second clinical skills webinar, where we focus on clinical assessment for minor ailments. My name is Matthew Peters, Service Development Pharmacist at Newmark, and I'll take you through this 30-minute webinar. In this webinar, we focus on some common clinical conditions and minor ailments that present in community pharmacy and skills we can use to help gain the maximum from these conversations with patients. Since the launch of the CPCS service in England, data from Pharm Outcomes has highlighted that the most common conditions presenting in community pharmacy include sore throats and coughs, UTIs and cystitis, minor eye and ear conditions, and a variety of skin conditions. Before we move on, let's recap on what we covered in the first of these clinical skills workshops. Have a think about the topics we discussed and how we might use those skills as we move through this second webinar. In the first webinar, we focused on the benefits of a patient-centered approach to conversations, looking at good and poor types of conversation and skills and techniques you can use to help with everyday conversations with patients. Within this webinar, we will look at some common conditions and how to apply our skills to gain the maximum benefit from a consultation. This is designed to encourage you to think differently about your consultations and how these skills can benefit your practice, as well as highlighting any potential red flags that would prompt referral. Bringing these skills together with what we learned in the first webinar will support you in gaining the maximum benefit from your interactions with patients. Patients should be put at the centre of their own healthcare, and although you, the pharmacy professional, are the expert in medicines, the patient is also an expert within the consultation with respect to their health and social situation. It is important to view the patient holistically and consider the big picture of internal and external factors that may influence adherence to a management plan. This means understanding and respecting values, culture, family structure, and beliefs of your patients, and understanding the ways in which these will affect the experience and management of their health issues and the way in which they take their medicines. There are a range of techniques or acronyms you can use to help you remember how to gather this information, including I2C6, which covers the person's identity, inform the person of what you're doing, consent, whether this be verbal or implied, what you can call the patient, confidentiality, whether they want to chaperone, the comfort and dignity of the patient, and clean hands. The second one we talk through is LICEF, which covers lifestyle, ideas, concerns of the patient, expectations, and what are their feelings. Lastly, we cover Socrates. This can be adapted to provide the information of a consultation and was originally used as a pain score. This covers site, onset, character, radiation, associated symptoms, timing, exacerbating or relieving factors, and severity. When speaking with customers, it's important to act in a way that ensures we get the maximum amount of information from a customer during the consultation. Here are some simple tips to assist you with this, which will keep the customer more engaged, as well as some things to avoid too. If the customer feels they are being listened to, they are more likely to share key information. Before we move on to specific conditions, we're going to cover red flags. Can we eliminate any red flag symptoms first so we can refer quickly if appropriate? The Newz2 system is a great tool to help you highlight if any red flags are present, and although not a diagnostic tool in community pharmacy, is well recognized by other healthcare professionals if there is a need to refer. Some general red flags include unexplained weight loss, tired all the time, fever and night sweats, bleeding, whether this be coughing up blood, vomiting, or passing blood. And when thinking about meningitis, symptoms such as a non-blanching rash, neck stiffness, and photophobia. It is symptoms like these which should prompt you to think, is urgent referral to secondary care needed? And whilst the majority of minor ailments you'll see in community pharmacy will not be associated with sepsis, it is important you're able to identify when it is and improve the chance of a positive outcome for the patient. We'll quickly run through the NEWS2 score. Firstly, respiratory rate. This is also known as your breathing rate and the number of breaths that you take per minute. When checking this, try not to make it obvious to the patient, as this will affect their breathing rate as they're focusing on it. Try to do this whilst you're checking their blood pressure at the same time, and that way they don't know that you're watching them breathe. SpO2 is a measure of the amount of oxygen in the blood and can be measured simply with a pulse oximeter. These are a great tool to support your consultations and can be purchased quite cheaply. SpO2 scale 2 is for patients with type 2 respiratory failure. The question of is a customer on air or requiring oxygen is less likely to be present in the community setting. With checking systolic blood pressure, check you have a calibrated machine in the pharmacy with a selection of appropriate cuff sizes. Does your blood pressure monitor also measure pulse and heart rate? The question of consciousness is whether or not the customer is alert or not, or are they confused? New confusion in an otherwise alert individual is a warning sign of a serious underlying illness. AC-VPU is designed to flag up new confusion so that medical help can be sought before the patient deteriorates further. Temperature. Do you have an accurate tool or device for measuring this? The most accurate temperature measuring device is an ear thermometer. The NEWS2 scoring system has been validated for all-cause patient deterioration. Although there is currently limited evidence for the predictive value of NEWS2 in the community or a primary care setting, it provides an objective assessment of a patient's physiological state and adds to clinical judgment. For example, it may be useful to measure baseline NEWS2 in frail patients in order to detect a change against this baseline. NEWS2 is a tool to support your clinical judgment, not replace. There may be instances where you find it more appropriate to seek urgent advice from a GP or other healthcare professional, such as the ambulance service. Here we have a useful graphic that can help to highlight some presenting complaints that may point your thought process in the direction of sepsis. The reason we highlight sepsis is because over 70% of cases arise in the community. Ruling out some of these symptoms will assist your clinical assessment and whether or not you should consider deeper investigation using the NEWS2 scoring system we talked through in the previous slide. Thinking about what we have mentioned on the previous slides, here are some simple tools that will enhance your clinical observations when assessing a patient's symptoms. The addition of these three simple tools will help to support your consultations and provide you with an improved overview of the patient's current clinical state to therefore improve your decision-making process. Firstly, the pulse oximeter, as we mentioned in the NEWS2 score, works by shining light through the nail. One thing to ensure is that the nails are clean and free from nail polish, as this will affect the reading. Nextly, blood pressure monitors. Check your blood pressure monitor is listed on the BIHS list of validated monitors. When checking blood pressure, this is also the good opportunity to check the patient's respiratory rate. Watch for the chest rising and falling, and doing so how many times it does in 30 seconds, multiply by 2 to give the reading in a minute. By doing this at the same time as checking blood pressure, the patient is not actively aware you are checking it and will breathe more naturally. Thermometers. The ear thermometer is the most accurate, and it works by shining light against the inside of the ear. This can be impacted if wax buildup is present and may give lower than actual reading. Consider this and check the ear temperature by the other ear to compare the readings. Our last webinar focused on how to get our consultations and conversation skills back up to pre-COVID times. In this webinar, we look to build on these skills and apply them to common minor ailments and presenting complaints in community pharmacy. Statistics show us the most common or challenging presenting ailments include minor eye conditions, minor ear conditions, skin conditions, sore throats, and UTIs. In this webinar, we will focus on eye, ears, and skin with a focus on point of care testing, including sore throat testing and treat, and UTIs coming later in this series of webinars. Ear conditions and complaints are common in community pharmacy, with the majority presenting as either ear discharge, earache, dizziness, or vertigo and imbalance. When assessing a patient, don't forget to use your senses. What can you see? Is there anything obvious by touch? Is there a smell associated with the presenting complaint? Is the ear red, inflamed, or is there any trauma? Going back to the tools we discussed as part of News 2 and red flag symptoms, would you benefit from having an otoscope in your pharmacy? Remember to always start with a good ear before checking the problematic ear. This gives you a good comparison and also reduces the risk of cross-infection if present. Linked to this, there are an increasing number of community pharmacies looking at ear care and wax removal services. Have a think if this is something that would benefit your practice. The most common types of ear complications are typically otitis media and otitis externa. It is important to remember that the ear canal is part of the external ear and not the middle ear. This is where an otoscope device may help your practice in diagnosing ear conditions and being able to offer the most suitable treatment. Understanding the structure of the ear and typical symptoms of ear infections, whether this be bacterial or fungal, or whether or not there is any damage to the ear, will assist this diagnosis. The exterior of the ear may look perfectly normal, but being able to see inside the ear may paint a very different picture. This also supports you to help diagnose if there are any red flag symptoms, such as a foreign body in the ear, which may be causing the pain. If you offer a microsuction service, then sometimes these can be removed easily. However, for the majority, it will mean a referral to A&E. Linked to this, have you thought about offering any private PGDs to support this, or are you an independent prescriber? Or what OTC products do you sell which can help manage or treat symptoms? Minor eye conditions are another common presenting complaint in community pharmacy. And in the community setting, diagnosing eye conditions will be predominantly on a visual basis. More often than not, customers will present with general discomfort in the eye, watery, and perhaps a gritty feeling. When we think of eye conditions, we typically think of conjunctivitis, and it is important to be able to identify between the different types and their causes. The most common form of conjunctivitis is viral, which is extremely contagious but is generally self-limiting. Management is conservative with lubricants and cool compresses, which can provide symptomatic relief. Bacterial is less common and is more often than not unilateral rather than bilateral, a good indication as to whether this could be bacterial or allergic. Bacterial will typically have some degree of discharge, which is less likely in allergy. With allergies, it is important to remember that for the majority, they occur mainly in the summer months. Many people are affected all year round. When assessing a patient's eye condition and presenting complaint, it is important to consider any red flags such as sudden onset, photophobia, fever, recent trauma, and vomiting. These symptoms may be due to a more serious underlying cause and should be referred to for further investigation. It has recently been suggested that chloramphenicol drops should be avoided in under 2s due to the product's boron content, which can affect fertility in later life. Some manufacturers have since added this to their product literature. To support this, the Pharmadoctor PGD for conjunctivitis enables you to treat infants where there is no licensed OTC product. Skin conditions are another common presenting complaint in community pharmacy, with a vast array of varying conditions which can be tricky to diagnose. Here we'll focus on a brief overview and look to build on specific areas in future webinars. Over half the population experiences a skin condition at some point during the year. Most self-treat and 14% will seek further medical advice. Indeed, skin disease is the most likely reason for a patient to consult their GP with a new problem. An estimated 13 million people in England and Wales go to the GP with a skin problem each year, accounting for 15 to 20% of the GP workload. Skin conditions are among the most common reasons for patients to visit their GP, but with the restrictions in NHS prescribing for minor conditions, many are being directed to their pharmacy for treatment and advice. Let's look at some of the more common conditions. Acne affects 80% of 11 to 30-year-olds and 20% of over 25s. Psoriasis affects some 1.8 million people in the UK, and the number of diagnosed cases is increasing. Eczema is one of the most common skin conditions affecting 1 in 5 children and 1 in 12 adults. Rosacea is a common problem too, and affects only 1 in 10 people in the UK, mainly those aged 40 to 60. Identifying skin conditions can feel tricky at times, especially when it appears a little more out of the ordinary. The Primary Care Dermatology Society is a leading UK society for all members of the primary healthcare team, and who have developed a tool to help with the diagnosis of skin conditions. The Cunliffe General Dermatology Diagnostic Tool is a visual diagnostic tool for inflammatory skin conditions and other rashes, including hair, nail, oral, and genital conditions. If you visit the link at the bottom of this slide, it will take you directly to the tool where you can search for further information on a skin condition, using either diagnosis based on history, diagnosis based on the predominant site, or diagnosis based on morphology. From here, you are then able to search based on the presenting symptoms, which will then take you to a host of images reflecting the likely skin condition to assist you with your diagnosis and advice to the customer. When assessing a customer's skin condition, think back to what we discussed regarding sepsis earlier in the webinar, and if there are any red flag symptoms present, we should prompt urgent referral. Other useful sources of information and learning include those you can see on the screen, each with their own unique resources to help you manage skin conditions and complaints in community pharmacy. Think about how you could support customers with your OTC offerings and enhance your service offering. One option you have is to do this via the Pharmadoctor Skincare Clinic package. This includes a variety of PGDs to give you the option to treat a broad range of conditions. Therefore, requiring you not to always refer customers to another healthcare professional for treatment, but can treat you there and then in your pharmacy. For those of you working in England, you may or may not have regular CPCS referrals to your pharmacy, as well as GP CPCS referrals direct from your local GP. To support this eventual national rollout, the RPS are running free workshops for community pharmacists across England. This is an excellent opportunity to learn more about the service and improve your consultation and clinical assessment skills, with direct learning from general practitioners who jointly run these workshops with other healthcare practitioners. They are continually adding more training dates, which you can book onto by visiting the link at the bottom of this slide. To build on our learning in this webinar, there are a host of resources freely available to you across the various nations to support your clinical and consultation skills. In addition to this, our training partner ECG have set up a dedicated community pharmacy hub page with a variety of online or face-to-face courses available to you to develop your skills further, both in relation to what we have discussed today, as well as a host of other services. To bring everything together, taking a person-centered approach may initially feel quite time-consuming, but only in the short term. In the long term, this can help prevent repeated visits and worsening conditions for the customer, therefore improving your relationship with them. Focus on taking the time to appropriately assess a patient, take a full medical history, and listen to the needs of the customer. This will help you to achieve the best possible outcome. In turn, this helps to raise a profile of community pharmacy through building continued trust with your customers. This change in mindset results in patients coming to see you first when they have a minor illness or potentially something more serious, trusting the opinion of the pharmacist, who will ensure they are offered the most appropriate solution to meet their health needs. That brings us to the end of the webinar. I hope you have found it useful and that you have some key techniques to utilize to gain maximum benefit and have a quality conversation on minor ailments. In terms of next steps, after watching this webinar, we recommend you take a personal responsibility to implement your learning back into your pharmacy. This is a time to think about what you have learned, what you could do differently to improve things for yourself, your team, and ultimately the business. The new mock training library is available free of charge to our members, and you can register today by visiting the link on the screen. When you access the new mock training library, we have a dedicated webinars page where you can download a post-course commitment sheet for this particular webinar. You can choose one of the commitments we have listed or write your own. If you would like a certificate of completion, you can take the short quiz, and this can be used for your CPD. I do hope you have enjoyed this webinar and found it useful. We look forward to you joining us in part 3 of the Clinical Skills webinar series. Thank you.